Hi guys, Dr. Rylan Gore here, breast surgical oncologist. I'm going to be speaking with you about pregnancy-associated breast cancer. This is breast cancer that is diagnosed during pregnancy or within that year after delivery. It comprises about 2% of breast cancer cases, and there are about 275,000 cases diagnosed each year. Diagnosis, number one. The first modality we like to use in pregnant women is ultrasound because there is no radiation associated with receiving an ultrasound. It gives us a chance to look at the mass, look at other concerning features. Mammogram. This is something we actually should talk about. A lot of people don't like to do mammogram during pregnancy because of the potential radiation exposure to the fetus. However, this is a great imaging tool, and if there's a high suspicion for breast cancer, we like to use it, and it needs to be documented in the patient's chart. And it also gives us information that we will not get on ultrasound, such as architectural distortion, calcifications, other findings that we just don't see on ultrasound. Treatment considerations. Surgery is almost always the number one treatment for breast cancer if it is still early stage. Unfortunately, pregnancy-associated breast cancer is usually caught late, usually stage 3 or 4, because of the fact that a lot of people don't believe that a woman can get breast cancer during pregnancy, unfortunately. So it's usually caught late, so the overwhelming majority of patients need chemotherapy first or mastectomy, depending on exactly where she is in her pregnancy. But one of those modalities need to happen, period. Chemotherapy is absolutely safe during pregnancy, especially when you get into that second and third trimester. What about radiation therapy? It's a modality we use in treatment for the overwhelming majority of patients, and it's absolutely contraindicated during pregnancy. Do not pass go. Do not collect 200. The potential radiation exposure to the fetus is just too high. Don't do it. Don't do it. If a patient is undergoing chemotherapy, depending on where she is in her pregnancy, there needs to be planning for delivery of the fetus. Again, you gotta put it on hold for 3 to 4 weeks prior to delivery. So there is a lot of planning involved, and as with all cancers, but especially breast cancer, this is a multidisciplinary approach. So that means that the OB-GYN needs to be involved, the breast surgical oncologist, the medical oncologist, the radiologist, psych services, other programs that the woman may need to get not just through the pregnancy but through a breast cancer diagnosis. All of that needs to happen. A huge point that I need to make, and this is a very common question: do I need to terminate? Absolutely not. I know plenty of women who've been diagnosed with breast cancer and they've been able to make it through such a devastating diagnosis while pregnant. So it can happen. You don't have to terminate your baby. You don't have to get a mastectomy depending on your stage when you are diagnosed. Okay, so this has been the quick little blurb about pregnancy-associated breast cancer. I look forward to speaking with you guys again in the future about other breast-related topics. Thank you. Dr. Gore, signing off.